bit about that preparation for your restart. So in terms of some of the challenges, the obvious one there is this financial impact. The fact that we've actually stopped operating, we've had no income, we're still having to deal with equipment, the cost of that equipment, the cost of employing people. So again, we're at a point where financially we're probably at the wrong edge of where we want to be. So that's having a huge impact on where we currently are, and also about the need to actually start to get back up and running as quickly as possible, but we've got to make sure that we do it in a safe way. We've got to recognize the impact on staff. You know, that's huge in terms of the way, you know, we've gone from a normal business activity to suddenly stopping that. We've got people now working from home. We've had travel restrictions. So we've also got the fact that there might be concerns and worries about COVID-19. So again, there's a little bit around that well-being. So again, we've got to recognize that impact on your staff. Also, as we move towards restart, what about the public? Are the public going to be comfortable flying on our aircraft again? So again, we've got to be thinking around how do we make sure that the passengers have the confidence to return to flying again, and what are we doing to try and promote that and provide appropriate levels of protection for them. Let's not forget, for the CAA Nepal, they're having those same impacts in terms of the financial challenges, the resources, the remote working. All those are having an impact not only on you within the industry, but also within the regulator. And it's really about how do we find a way to restart safely, because we can't afford to end up having a significant event as we move towards restart. You've only got to look at what's happened in Pakistan with the Pakistan International Airlines crash. You know, there's a lot of COVID-19 impacting on that particular accident. So again, we need to make sure that as we start to restart aviation in Nepal, we don't end up in a similar situation. We've also got to recognize that COVID-19 information is changing rapidly. From what we knew 4 or 5 months ago to what we know now, things have changed, and therefore it's become quite challenging in terms of where we've come from to where we are today. And everybody has been learning as we go. So on day one, nobody knew much about COVID-19. Yes, we know a lot more. We don't know everything. So we've got to recognize there is still this thing where things are moving, and sometimes they're moving quite swiftly, and we're having to try and find ways to adapt to that changing environment, or that changing bits of information. So it's really about whether you as organization, these, you know, 4 simple questions, I would say. You know, what is the most likely cause of your next accident or incident when you restart operations? You've got to be starting to ask that question. And how do you know that's what's going to be the most likely cause? And then what are you going to do about it? And once you've done that, you need to make sure you're thinking about, how do we check it is working or not? And those 4 simple questions actually are, in effect, your SMS. And that's what your SMS can do, because when you start looking at your SMS, we're starting to ask those questions. And again, it's very cyclic. We have to keep asking them, you know, what is it we don't want to happen? And obviously, the obvious one is an aircraft accident. And how do we prevent from happening? What could cause it? What actions do we can take? And how do we check it's going to work? We've got to keep challenging that and keep asking those questions, because it's all about trying to use our SMS to manage your risks, to prevent those bad things from happening. And those risks have changed. The risks that we had pre-COVID are going to be very different. And actually, we're probably at the highest risk point in the aviation system that we've ever been, because we've gone from a normal operation environment, we've suddenly stopped, and now we've got this, we're going to start to restart where everybody's out, we've got out of our routine. Nothing is normal at the moment, and therefore, as we start to think about coming on to restart, we've got to think about that's going to have an increase in our risk, and therefore we've got to be able to make sure that we're conscious and able to manage that. We've got to accept that things are still going to go wrong, but we want to try and find ways to minimize the consequences when they do, and also reduce the likelihood of bad stuff happening. And you know, the key thing here is the SMS is the vehicle to do that. It can help you identify and then analyze some of those safety risks and prepare you for that restart. So it's really about using your SMS. It's there to do a lot of this stuff. It's there to help you understand and manage your risks. It has an emergency response planning activity in there. And that the principle of the emergency response plan is to allow you to go from normal operations into an emergency situation or a crisis situation, and then bring yourself back up into normal operations again. And this is what COVID-19 has actually done to you. So again, it's a vehicle that was there that you could use to take you from normal operations into the crisis situation and to help you come out of it. In the same way, your management of change is another useful tool as part of your SMS. As you're changing from one phase to the next phase, because some of you will have gone from normal operations into no operations, into some repatriation flights and humanitarian flights. So you might be carrying cargo in your cabin. So again, the management of change should have been used to help you make sure you're operating those flights safely, but also using it to help you come out of restart safely. You've got your existing safety committees about you as part of your SMS. So once again, they're things that you can use to manage the restart. So again, you don't necessarily have to have separate committees for this. Use your existing SMS committee to do that. You do have to go back and look at some of your previous hazards and risk assessments because they may have changed. The way you're going to be operating as part of restart might be different. Some of those risks are going to be higher. So some of those previous risk assessments might need to go back and actually reviewed and be revalidated. And then it's about making sure you start to plan that restart in a way that is going to allow you time to build that level of comfort in the organization that you're going to do it in a safe way, and build again, get yourself back to build into that routine. One of the challenges that you're going to have is around data and information. And it might be quite limited what you have. So it's around trying to find ways of gathering as much information as possible. And that might not necessarily be information that you get internally. It might be that you've got to reach out to relevant experts from outside the organization. It might be from international organizations. Certainly IATA, ICAO, EASA have really done a lot of stuff in terms of producing good and useful guidance material to help both the regulators and industry as they move towards restart. Again, looking at what is going on in terms of the region, in terms of neighboring states. It is going to be a time when you might not have the data to do a normal risk assessment, and you might have to use expert judgment instead. And that means that your risk assessments are probably going to be more around qualitative information rather than quantitative data. There's an opportunity here to share amongst yourselves. So sharing information between yourselves, sharing some of your challenges between yourselves is going to be good for, it's a win-win situation if you can do that, and it's got to be good for Nepal and the aviation system. But also you've got to be continuously monitoring for any new and updated information. This is going to be a dynamic environment. It's a dynamic environment now. It's going to be even more dynamic as we move into that restart situation. So I mentioned at the introduction about integrated risk management, and I think one of the things that we have to think about is when we're looking at making the decisions we need and the risk management, we've got to think about not just the aviation safety risk, but we've got to think about the public health risks. You know, there is a risk of the infection being passed because aviation is a vector for the infection being transmitted from one country to another country. So we've got to recognize that although we're focusing on our aviation safety risk, we've also got to, there's a responsibility we have around trying to prevent the spread of the infection through the aviation system. We've got to think about our own staff and their well-being and the risks around that. So again, something that we need to think about, and also around the aviation security risk. So when we're starting to think risk now, we're going to have to start think wider than perhaps just the aviation safety risk. And that in itself is going to be some challenges. What we need to make sure is that, you know, that public health risk is quite significant. Where, you know the financial challenges of where you currently are. If the risk of infection isn't controlled within Nepal through the aviation system, then we might end up with another lockdown. And the last thing that the aviation system needs is another lockdown. So to protect our industry, we've also got to be very much thinking about how do we take on some of that responsibility to protect or reduce that risk of the infection spreading through the aviation system. And it's about the 3 C's. It's about cooperation, collaboration, communication. And this has got to be at both at an international level, a regional level, at a national level, at a local level. And it's where we've got to start to come together between the regulator and the regulated. So it's about that cooperation. And again, in effect, this is what we're trying to do here during this webinar. It's also about collaboration, cooperation, communication within the industry. Now that's going to be between you, the operators, and the airports and the ground handling organizations, and not just those airports within Nepal. It's going to be the airports, ground handling organizations, and those other organizations that in terms of destinations. So again, it's going to be a real key in terms of how we do this together. All the time, we're trying to find a way of balancing the safety space where, you know, we're between these two areas of, you know, how do we ensure that we stay safe? How do we ensure we avoid bankruptcy? And, you know, this challenge between protection and production, where are we sitting at the moment? And, you know, we have a financial management system to protect us from the financial woes, and we have our safety management system protecting us from that catastrophe. How well is our safety management system working? How good are our defenses? Where are we sitting in that safety space? Do we really know where we are? Are we safe? Do we feel we're safe because we haven't had an accident? Is that because we're good at what we're doing, or is it just because we're lucky? So again, it's about trying to make sure that we have a robust safety management system right now is going to be even more crucial than normal. When we start to look at managing those changes that we're going to need to put in place, we need to think of it in different phases. So we've gone from that phase from normal operations into no operations. We'll have gone into a phase where we've gone into some activity, and now we're thinking about it in terms of restart. And we might even want to break that restart into phases and not just think that we can go straight back into normal operations. We might want to do it in a phased way. We've got to identify what are the issues and conditions that may affect the safety of your operations. And also we've got opportunities to cross-check those safety issues about what have we previously identified through our SMS. What about what we're seeing in terms of the guidance material produced by IATA, EASA, ICAO? Is there anything that we can pick up from those other areas? It's about focusing on those issues that are going to have a direct impact on operational safety. But also it's about looking at the impact of some of your processes and procedures might have to change because we're in a different environment. So what is going to be the impact on those existing processes and procedures, and do we need to review and update them? We've got to watch ourselves really closely as we go towards this restart and be looking for the unexpected. So we can't predict what's going to happen. We don't know what's going to happen. We're moving into a period of uncertainty, and therefore, as part of that, we've got to look for the unexpected. It does require this collaboration with stakeholders, and that's stakeholders and even competitors, because you can all work together on this to try and make the improvements for everybody. In terms of the impact on your operations, these are just some of the key ones that you're probably aware of, but these are challenges. How do we maintain the right distancing in the operational areas? That's not just around passengers, it's around the workforce. How do we deal with an aircraft turnaround? How do we ensure that we do limit the exposure of our people to close contact? We may end up with reduced personnel, partly because it might be we've tried to cut back due to reducing the amount of the operation. It might be because we still have staff that are vulnerable who aren't in a position to come back to work. It might be we're going to see an increase in people due to stress, due to other reasons, or it could be because of family members who are sick. We might end up with a challenge in terms of the amount of personnel we have. We've got to think about the airworthiness of the aircraft. A lot of the aircraft have been parked up. Aircraft don't like being parked up. Aircraft like to be flown. So we've got to recognize that when we start to pull these aircraft out from their storage and start using them again, we're going to have teething problems. We're more likely to have component failures, system failures, because the aircraft have been on the ground for so long. So how are we going to make sure that we manage that risk as well? Also about the operational impacts of flying with a mask. So it's going to affect the flight crew if they need to use oxygen. It's going to affect the communication if people are wearing masks. So we need to think about some of those challenges. We've also got to recognise that there's going to be this challenge of recency on operational staff, and it's not just focusing on the pilot. So that side of thing is very important, but we've got to think this is everybody. And it's something as simple as how many people, when they get back into restart, are going to arrive at the office and will have forgotten their passes. Something as simple as forgetting their passes. We've got out of the routine. We've been working from home. So we've disrupted our routine. Something as simple as that is going to be something that we're going to have to think about. People are going to be doing silly things because they haven't been doing them for such a long period of time. People have forgotten how to do their daily work because they're doing things differently. Even in the maintenance environment, a lot of the maintenance engineers have been focusing on care and maintenance and storage and not necessarily doing the typical line maintenance turnaround that they were doing pre-COVID. So again, we've got to recognize that. Also, because to protect the infection from a public health perspective, we're having to do additional aircraft cleaning. That means that we've got to give time to be able to do that. That might mean longer turnaround times. So again, we've got to start thinking about how do we make sure that we plan to give sufficient time for that, because if we don't, then we're either going to end up with the cleaning not being done effectively, and therefore we're at risk of the spread of the infection, and that could affect our own staff. So again, we've got to make sure we build in the capacity to be able to do that. We've got to recognize our people. So people are going to be distracted. The flight crew on the Pakistan International Airlines spent most of the flight talking about COVID-19 and the concerns over it. We need to make sure that we need to recognize that our people are going to be distracted when they come back to work. I'm not sure we can stop that, but we've got to recognize that, if nothing else. As I said earlier, it's about that loss of routine. We're out of our routine from what we normally do. People will have those concerns about staying healthy and not being infected, but also because of everybody's aware of the financial impact and the way globally everybody's job is there's concerns over people's jobs. So is that going to affect the way they do their jobs? We need to think about people's mental well-being under this environment. People are stressed. People are going to be concerned, and therefore that might mean they make mistakes or more mistakes as a result of that. And also around fatigue, you know, we might be operating things differently because there are restrictions at destinations that might mean we're having less time at a destination. We might be having to fly and return rather than fly and stay over because of quarantine restrictions. So again, we might be having to manage that fatigue more closely. And it's really around everything we do about our people. How do we make sure it's easy for people to do the right thing, difficult to do the wrong thing, and impossible to do something catastrophic? It's about making sure that we create the environment which allows them to do that. I'm just going to cover some of the guidance material that's out there. Certainly from an ICAO perspective, there's still some stuff in their safety management manual around management change, around the SMS. So don't ignore the stuff that's the basic principles around SMS. But there is a safety management implementation website that is freely available. The link is there, and again, that will be available to you. It has a COVID-19 page. It is around providing lots of reference material to help both regulators and industry look at how they can address the challenges of COVID-19. Both things like when you're operating into passenger aircraft for cargo to starting to move towards that restart. So a lot of the stuff from EASA that I'm going to show you is also on that website. So again, it's a useful source of information that you might want to seek out. IATA, they have a guidance document around flight operations. You'll see that they've actually got a whole series of different hazards and possible controls. So it's something that, again, they've already done some work for you. So you will still have to look at each of these and you can look at them and say, does this apply to me in our organization? Can I put in place those existing controls that they are proposing? And work out your own probability and severity. Now, the risk ratings they've provided aren't necessarily going to be yours because you're going to actually have to do that calculation yourself. But certainly it's available to you to help you in terms of starting to look at, this might be a useful starting place in terms of developing or identifying the hazards and risks around restart. And also, EASA have a guidance document, similar sort of thing. It has a lot of information from different perspectives. So from the organizational perspective, from the flight operations perspective, from the training perspective, the planning crew scheduling perspective, ground ops, and the maintenance perspective. So again, they've broken it down, and you can see there is an example there where within that document, you'll find there's a lot of stuff around, for example, around the crew reduced situational awareness. So that it talks about that hazard, it talks about some of the consequences of that, but also around some of the different risk mitigations that you could consider putting in place. So again, it's another document that has some useful information to help you think about, have we thought about everything in terms of restart? So when it comes to establishing, a lot of people talk about a new normal. I don't think we're going to be going back to where we were pre-COVID. It's going to be COVID-19 is still with us. It's still going to be with us probably for many years. So we've got to think about what is going to be the new way of operating, the way we do business. So we're going to have to plan that restart, and ideally it should be a phased restart. Let's think about where do we want to start our operations. Let's start slowly and build up. As we get more confidence in how the operation is going into this new normal, the more we can then start to increase the flights and the routes that we take. We do have to consider your people in terms of the impact on them. And so again, it's around trying to make sure that we perhaps need to build in a little bit more flexibility and contingency so that we're better prepared for the unexpected, and almost building additional capacity to start with, even though we're not necessarily using it all, but making sure we have the availability of people, aircraft, equipment, more than perhaps we need to, just to make sure that there's going to be an aircraft that's going to go tech. There's going to be flight crew who are going to suddenly go sick. That, all these things are going to be happening as we move towards restart. That's a challenge when we're concerned about our financial well-being, but it's something that we need to make sure that we do that. It's about focusing on the procedures and our defenses. And this is, it goes back to our SMS. Our SMS is building our defenses to protect us and making sure that those defenses are working and they're effective. And if we can do that, it means that we're more likely to be able to restart safely. And that's what we're really trying to do. We've got to anticipate the unexpected. We're in this environment where there's a huge amount of uncertainty, and therefore we can't get complacent. We've got to be starting to look for the unexpected and be prepared for it, and know that. And the only thing that is certain is there is going to be some uncertainty. It's a time when we can't afford to take excessive risks. If we take excessive risks, everyone loses. So again, we've got to recognize this. We're all in this together. Whether it's in terms of the Nepal aviation community or whether it's the global aviation community, we're all in this together. So we've got to try and find ways of making sure that we do this in a very planned and safe way when we go towards restart. This means that we're going to have to up our game in terms of the monitoring our performance and how we're going towards that restart, because there are going to be more unknowns. Our systems, our operations are going to be a lot less reliable than they were pre-COVID. People are going to be less familiar with their roles. People are going to have to be reminded and start to get back into their routine of what they used to do. So this does mean that we're going to have to look at how we increase that monitoring. And that means that the importance of the safety manager and their team in terms of looking at what is going on. The importance of the quality assurance manager in terms of what they're looking at in terms of the oversight. And also the flight data monitoring manager. So again, looking at what is going on in terms of trends really closely when we start to move back into normal operations. And again, it might be looking at some of the weaker signals, because there might be something in those weaker signals that might sort of jump out at us. The chart on the right is something that IATA has already identified in terms of the operations during the pandemic. So this is not really restart, it's more during the pandemic, is there's been a huge increase in unstable approaches. So again, something to be aware of, something to look for as you go towards restart. Certainly somebody's already identified that there is likely to be an increase in unstabilized approaches. So perhaps that is something that you're going to have to start focusing on in terms of pilot training, in terms of your process and your procedures, in terms of your operation, your planning. So again, it's around looking for these sort of things and what you can put in place to manage things and detect things early and not wait until it's too late. One of the challenges that you have is that some of those decisions that you need to make about where can I operate to, but then starting to look at what is the exposure to infection in those particular destinations. So from where can I operate, you might then end up saying, well, where should I operate? And you know, this is where your SMS might be using your SMS to start to look at which of those destinations am I going to choose to operate, and I might have to start looking at what considerations am I going to need to put in place to protect the organization, to protect the people, your staff and your people. And that is going to mean that there's going to be an individual risk assessment for each route you take, because you're going to have to make that considerations. Now, again, sometimes those decisions are made by the government. Certainly from a UK perspective, where can I operate isn't decided by the operator, it's decided by the government. The government has said these are the only countries where we're allowing aviation to operate into, except for repatriation flights. So again, there's also about looking about what information have I got in terms of that decision making, in terms of where can I operate. Safety performance indicators, quite a challenging area under COVID-19, and I think for me, it's probably shifting away from your traditional safety performance indicators and really focusing on your capacity and your defenses. So again, it's around that sort of thing, around looking for weak signals, looking more about focusing on the availability of personal equipment, you know, and that includes, you know, the availability of the aircraft. Again, you might be starting to look at things like, even things like availability of PPE for the crew. Certainly, you'd want to see an increase in safety reporting under this environment. You want people to tell us what are their challenges in trying to deal with the COVID-19. That might be to do with the wearing masks. It might be to do with challenges at the airport. It might be to do with challenges when they arrive at a destination. That's the kind of stuff that we need to get in. If it's reported, we can understand it better, and it might help us in terms of making some further decisions about additional mitigations. Certainly, from to reduce the spread of infection, we need to ensure that whilst the passengers on the aircraft, we maximize the airflow within the aircraft and when the aircraft's on the ground. So actually having we want to have our air conditioning packs as reliable as possible. So having an SPI about air conditioning pack reliability is something that is going to be something to consider. You might even start to look, and I know it's in the IATA guidance material, you actually you change your minimum equipment list restrictions on air conditioning packs, because you shouldn't be flying an aircraft without full air conditioning under this current environment because of the risk of reduced airflow means increased possibility of the spread of infection. So again, something to think about. Again, looking at developing SPIs around the training, because a lot of people are going to need retraining, refresher training, additional briefings. You might want to start to increase the amount of briefings to prepare people, crew, at all levels of the organization as they start to return to work, to make sure that they are comfortable and familiar with their role, because it's been a while since they've been doing it. Again, looking at the number of safety and quality audits, because it is going to be something that we need to increase as we move towards restart. So again, it's a measure of the more you're doing, then that means you're looking for the unexpected. You're looking for how well your defenses are working. So in terms of some of the key takeaways, it's really about, you've got to be prepared for this. You've got to start planning. You should be planning now in terms of where you go towards that restart. It's about using your SMS to protect your business. It's going to be what's going to be the difference between, you surviving this. It is there to protect your business. It's there to ensure that defenses you need to put in place to ensure that you can return to business safely is going to be there. It does require this cooperation, collaboration, and communication. It's such a key thing. And again, it's around between the regulator and the regulated. It's between the different operators. It's between you, the operators, and a lot of your customers, your contracted organizations, your ground handling organizations, your maintenance organizations. These are all really important interactions and interfaces that are probably more important right now than they've ever been. It's important that you start to learn from your experiences here and share some of those lessons learned. You are going to trip over as we go towards restart. Things aren't going to go perfectly. They're not going to go as smooth as you want them to. But every time they don't, try and put in the effort to try and understand what went wrong, what can we learn from it, and try and find ways to share it with others. Share it with your competitors, because again, it's around trying to make sure that we all get this safe. We all want to end up with a safe Nepalese aviation system. And let's not forget, you have one of the highest risk aviation environments because of your terrain, because of your weather, because of your altitude. All of those things make it really hard for the Nepal aviation community. You're already managing a lot of risks, and now you've got COVID-19 that's just going to compound those risks and how you manage that. So again, please look at how you can share those lessons learned. So that's it from me. Hopefully that's been a useful opportunity for you. And just again, it's just sharing some of that perspective from what we're seeing from an international perspective. And again, hopefully that's been a useful short presentation.
Right. Thank you very much, Simon. Yeah, it was a well concise presentation that you had over there. I hope all of us can utilize that and restart our aviation in a very safe and with safety in mind for not only the passengers but also for our own internal staffs as well. So with that being said, I'd like to request all the participants to please message in your questions if you have any, so that we can compile and ask Simon. For now, I'd like to invite Raju sir to share or to make a brief presentation from CAAN side. Okay. Maybe he's muted. I don't know. Let me check.
Okay, thank you. Thank you, Utsav, for this invitation for the quick update from Nepal side, from Nepal authority side. So can you hear me now?
Yes, sir.
Okay. Thank you for the chance for the brief highlight from Nepal's Civil Aviation Authority side. So being a second speaker is good point, since a lot of items have been covered by Simon, so I don't need to repeat all the things and they already have been covered in detail. So what I would like to emphasize about the orders from CAAN Nepal side is that we have been carrying out many such remote meetings, and sometimes we have physical meetings with physical distancing. So it's not something new that people are getting the new instruction or directive or guidance from Civil Aviation Authority in Nepal. We have been posting a lot of information regarding the safety precautions, health precautions, the security precautions with different safety circulars, directives, notices, and guidances. As rightly indicated by Simon, Nepal has also issued a different circulars and notice with regards to the elevation. And the operation of flight during this pandemic period is not something that is normal as compared to the pre-pandemic period. There have been a lot of constraints we are facing now, especially if you see the elevation measures CAAN has issued to the operators in order to ensure the continuity of the business throughout the Nepalese territory plus the other international flights. We should be very careful. We are operating in enhanced risk. He rightly stated some details regarding the recency, the proficiency of the aviation personnel who are working with the so-called not at the par. If you see the recency, if you see the proficiency, the status of the aviation personnel now and before pandemic period cannot be considered at the same level. That's how ICAO has issued many guidance materials with a lot of mitigation measures, how we can offset those missing parts, especially if you see the lot of quick reference guide, we can see multiple mitigation measures in each quick reference guide in order to make sure that equivalent level of safety can be ensured. I'm confident all our aviation community, they have visited the CAAN website where we have dedicated COVID portal. You can download all the guidance material, instructions, new updates, everything have been posted over there. You can visit and you can see a lot of things. Just to repeat one thing that the operation is not normal. The proposed operation from 17th of August, it's not normal, and there should be a lot of safety barriers to ensure that our operation remains safer. We know we perceive the enhanced risk to the Nepalese aviation operation in this given time, since there are a lot of safety hazards and risk we have to encounter, and we have to safely mitigate those issues. I would like to reiterate about the IATA publication of many numbers of unstabilized approach. These information have already been transmitted to our major air operators. I think they are quite aware of the IATA publication of the rise in trend on the unstabilized approach on one hand. And recently, just yesterday, I received one SIB from EASA regarding the need of the inspection of pitot static system. And this has already been transmitted to all the aviation community stakeholders and often airworthiness both. I'm confident that our post holders have taken necessary measures to implement that our operation will be safer when we resume the operation. I encourage all the stakeholders to visit frequently the CAAN website, ICAO website, and even IATA website, where there are a lot of guidance materials and the best practices are available for reading, and they are free of charge, and there is no secure portal, is all open. And one more issue I want to highlight over here is that Nepal is constantly engaging with different agencies like ICAO, where we are having different sort of exchange of information, whereby we transfer the good practices to our aviation communities. Just to give you an idea, we are engaging constantly with ICAO regional office in Bangkok. And there have been many communication circulars from Nepal side to the airline operators of Nepal. There are many subgroups, including safety subgroup, facilitation, aviation security, and public health. There are 3 different subgroups in Asia Pacific, ICAO Asia Pacific office. We call it ACCRPG. So there is a group of the aviation authorities and organizations, including ICAO, including IATA, ACI, IFALPA, etc., who are working together to make sure that our operation, the world operation, is safer and we can resume back to normal after the pandemic is over or during the pandemic period. In safety subgroup, there have been some issues with regards to the donning of the PPE and the possible safety implication that may cause any safety implications when the crew, the flight crew, or even the cabin crew, they don the PPE, and what might be the complications when all the passengers and the crew, they put on the mask in case of pressurization failure. So the safety subgroup is taking into account all those possible hazards, and they are constantly working on that. Number 2 is about the use of sanitizers. So this also came up prominently during the safety subgroup meeting. And the use of hand sanitizers, they are highly rich in alcohol content, around 70%. And one of the members raised the issue that since they are highly flammable, even the exposure in temperature of 13 to 14 degrees in sunlight during parked aircraft can also spark the flame. So this issue has been taken up by the safety subgroups and taken into account the practical difficulties. So we are also consulting the major aircraft manufacturers, and we're getting the expertise from different experts around the globe to ensure that the Asia Pacific region and ultimately the aviation community in the region get benefited. And this sort of information will be transmitted to all our aviation stakeholders in due course of time. So I did not want to present everything in slides. So since a lot of things were repeated with Simon's presentations, and I do not think it is necessary to repeat all things, just to save time and keep free time from the question and answer sessions, which I'm pretty sure there may be some chat functions where the question might have been posted over there by our audience. So once again, I'd like to thank Simon and our co-host, AOAN, Airline Operator Association of Nepal, and Aeronautical Society of Nepal for hosting this webinar. So I could not, due to the busy schedule, we could not bring a lot of people from CAAN Nepal side, since we're working towards the review of the SOP. So one more issue I want to highlight is the adherence to the SOP. If you see the latest CAAN guidance on ops, the resumption of flight during the pandemic period, it is a mandatory document for all operators to submit and get approval of standard operating procedure for this COVID period. And we have clearly stated over there that the operator, they have to apply the safety management principles to ensure that their operations are safer. This very sentence enough. How we should be prudent to keep our defense mechanism to ensure that our operations are safer in coming days. So the challenges, the hazards, they are not same or similar to those we used to have during the pre-corona period. They are completely different. So they are, we can see new emerging challenges with respect to the COVID hazards, especially with the health and different other things that have already been highlighted. I don't think it is necessary for me to repeat all those things again. So without taking longer time, I would like to once again request all the operators, especially the post holders, please bear in mind that due to the travel restriction and the limited mobility, the CAAN inspectors are more confined towards the off-site surveillance. We have very limited on-site surveillance at a given time. So we trust the post holders. When we assess the post holders, we trust them, and we have entrusted certain functions that they have to take into account and they have to monitor internally. Please do not expect the CAAN inspectors to be there on site as is to be during the pre-COVID period. Please, the post holders, I repeat again, please, post holders and management personnel, the safety is for everybody, it's not for the authority. It's clearly stated in the SMS principle, safety is everybody's business. Please deploy your more resources, take your internal mechanism to ensure that all the things go as if the CAAN inspectors were in the field. Although we cannot be there all the time in field, rather we're taking a lot of off-site surveillance activities, getting the scan copies, we're doing the desktop surveillance, we are in constant engagement with you through different webinars, Zoom calls, and different communication via email. We expect you to proactively reciprocate CAAN's gesture to make sure that all the efforts, they are well translated into safer activities from your side. Thank you very much from my side, and especially with the Simon, who kindly consented to become a speaker for this program despite this short notice. And Carlos, and I can see that Carlos is also there. So now we can thank our partners from the EASA to make this program successful. And on behalf of Civil Aviation, all the organizers, they deserve sincere thanks from our side. Thank you very much. Now we can proceed with the question and answer session. Thank you very much.
Okay, thank you, Raju, sir. Yeah, yes, definitely. All of us will be following the civil aviation guidelines and recommendations to restart our operations for safe flights. And with that being said, now we have a question from Yoga, sir. And his question is for Simon. And it goes like, if Simon, if you could highlight some of or share some of your experiences with regards to heli operators. So what any special preparations do the heli operators need to abide by?
Okay. I guess what's interesting for us in terms of helicopter operations, we haven't seen such a grounding of helicopter operations because a lot of helicopter operations have continued to operate because they've been operating domestically. And although they may have had several weeks during the initial period of lockdown, the restrictions that they have had have been quite limited, and therefore from a helicopter operations it's probably not that significant, but they are having to consider the use of PPE, and certainly they've had to sort of change some of their the main thing is around changing the operational aspect in terms of procedures, in terms of use of face masks for passengers. And so that's been the main difference in terms of pre-COVID and post-COVID. But in terms of things like training and all those sort of things, that has been reasonably continuous, and there hasn't been the same amount of restrictions from a helicopter perspective as perhaps there has been from the fixed wing. So I think it's been more of a challenge for the fixed wing operators because they're the ones that have had the aircraft in storage and on the ground for longer.
Thank you very much. And another question, I guess this was asked earlier. So I had shared with you, Simon, I guess last week. So this was the question from the fixed wing operators for international, conducting international flights. And one of the questions from them was which regulations or what kind of regulations should they abide by? Because it seems that all the different ICAO stakeholders, sorry, not stakeholders, but ICAO states, they have their own specific regulations. So for a fixed wing operator operating for international flights, if they're going to multiple countries, they'll have to follow different regulations. So, so what do we do in that sort of scenario?
So it's the focus is primarily on as I said in the presentation, it's about doing a risk assessment for each route. You're predominantly focusing on your primary regulator is the Nepal regulations, but you will, when you arrive at a destination, you will be subject to local public health regulations at that destination. But that would only be once you're at that destination, and there will need to be the communication as to what are the expectations at that particular airport and for that particular country. So you might end up with, when it comes to your location statements, you know, different countries will have different requirements when you travel from, when you leave country A, you'll be looking at what is country B wanting in terms of passenger information. So again, you'll have to be looking at what the country B wants so you can produce that for country B. And then when it comes to flying back to Nepal, then obviously it will be the information that Nepal is requesting. So again, it's a challenge, but you're going to have to be looking at it from both your departing airport to your destination, but also you are going to have to look at things like if you are flying with any alleviations or exemptions, will you be able to fly into that other country with those alleviations and exemptions? Because there are some states have made it clear that they will accept any alleviations or exemptions. There are some states that might not, and that might also include overflying certain countries. So this is where for each destination that you fly to, you're going to have to do that individual risk assessment. Now, it might be that this is where you can work together, where if 2 or 3 airlines are operating to the same destination, you could be able to work together to make sure that you all are looking at this and agreeing the same approach, so that it makes it easier for everybody, and you're sharing some of that workload. And it might be that you look at it for one route and one of the other operators looks at it for another route, and then you share with each other. And again, it's trying to use the opportunity to try and help in terms of resources, but you are going to have to look at it from each individual perspective. In effect, you should be focusing on what the Nepalese regulations and the public health regulations from Nepal are your primary source of regulations.
Yeah, thank you. And another one that we faced also from your international international operators, was that when we are traveling in such a way from country A to country B to country C, most of their definitions of high risk flight would change, right, based on, let's say, different countries, different states, how they consider. So they consider, let's say, state A would consider with number of severe cases, or maybe case B will consider with regards to number of your active cases, or case country C will with number of deaths, and so on. So is there a standard from ICAO or WHO that we all can abide by to formulate a, when we conduct risk assessment for our flights? So we are usually doing that on a operator's perspective, right? So is there a certain guidance that we all can abide by so that it will be a uniform guidance for all?
No, and it's down to individual governments and the public health authorities to make that determination. And certainly most countries will do that. They will have a list of countries where you can operate to. They're considered either high risk, and therefore there's high risk ones where you cannot operate to. There's the medium risk ones where you can operate to, but you have to go into a quarantine. And there are the ones where there's an agreed corridor which says that if you fly between these countries, there is no restriction or quarantine on arrival. So it's around, if that information isn't available, then once again, I think there's a need for the operators to come together and actually using, if the only information you've got is the WHO information, you can use that, and you could end up coming up with looking at determining a high, medium, and low risk based on the sort of infection rates, and again, base it on infection rates rather than fatalities, because actually infection rates are indicating to what extent there is infection in that country. And I know the WHO on their website there's a global map which talks about infection rate over the last 7 days, because that's a better measure. Because although you'll get a daily, they have situational reports that give you a daily infection and death rate, but that's only based on what is reported on that particular day. And things like over the weekend, reporting goes down, not because of less deaths or less infection, but because the ability to report tends to be done. So it's better to try and look at it over a 7-day period than looking at it over a single day. And to me, it's something that, again, should be something that you end up agreeing across the Nepalese aviation community. It should really also be engaging with the Nepalese public health authorities, because they should be, they have the expertise more than you do when it comes to that issue over infection rates.
Right, sure.
Okay.
So that would mean if we if we look at from the rate of infection perspective, so that will be more useful, is what you mean, right?
Yeah.
So rather than just looking at the aggregate total number of cases, so they might have surged last couple of months prior, and the recent rates have decreased. So for another country, maybe they have less number of cases, but the rate is increasing. So the latter one would be more high risk. So we can consider in that way. Thank you very much.
And it's going to be dynamic. So you know, we've seen countries, their infection rates have gone down, and then all of a sudden we've seen infection rates go up again. Yes. So what you look at today as being a low risk state today could be up in the high risk next week.
Yes.
So again, it is going to be, there's a lot of this stuff is going to be very dynamic because that information is going to be constantly changing. Australia was doing really well. Hong Kong was doing really well, and both those countries are now having huge or an increase in spikes in terms of infection rates. Mm-hmm. So what you thought would have been okay, now you might be saying actually we shouldn't be operating there at the moment.
Sure. So I guess we will all have to sit in with our local health authorities to finalize for internal, even for domestic flights and your international flights. Okay. So next question I have over here, I guess this would be directed towards Raju sir. So Raju sir, we have a question from Kedar sir. Is that so is there any requirement for us for now for testing of COVID-19 for all the frontline workers? I guess he's muted. Yes, sir. Sir, the next question is for civil aviation. Do we have any requirements for or mandates for the testing of COVID-19 for the frontline workers as of now?
I think he's trying to speak, but I can't hear him.
Yeah, neither can I. Okay, we will get to that later on.
Utsav, can I just respond to that? Yeah. Again, it shouldn't necessarily be down. If you're concerned about your own people, you shouldn't be waiting for CAAN to require that. You should be looking at doing it yourselves to protect your own people and try and reduce. What you don't want is one of your staff coming into work infected and then flying on an aircraft that then infects the rest of the crew. So again, these are the sort of things that you should be doing anyway around protecting your own people and trying to ensure that you don't end up with your own staff being infected or it being passed between one staff to another.
So this would come down to the management level of what acceptable level of safety we want to achieve, and the pros and cons of both. You know, like from your presentation, you showed the safety space. So what we would like to consider. Yes. Yeah. Thank you very much. Another question we have is from Mr. Sumit, and he would like to know for. Are there any thing that we can, or unexpected things that we can anticipate for the line maintenance?
So part of it is as we move aircraft out of storage, you're more likely to get system component failures. So again, it's increasing function operational checks. It's getting the line maintenance engineers back into the routine of doing line maintenance. And it might be that you need to provide some additional training for them because it's been a while since they've done it. So again, just remind them of the key things they'll be looking for in terms of line maintenance. We might be getting more aircraft damage from ground handling. So we need to make sure that the maintenance engineers are more observant to looking for any aircraft damage from ground handling. So again, it's just it is that sort of thing where you know, are we going to see more bird strikes because airports have now become nice areas for birds to fly in and to nest in. So, and sometimes on your aircraft, some aircraft have become bird nests where sort of aircraft have nested them. So all these things are the kind of things we're looking for. We might see an increase in bird strikes. So again, make sure that people are more observant for that.
Yeah, thank you. Yes, Raju?
Yes, I'm back. So can you hear me now?
Yes, sir, we can.
Okay, thank you. So I had some problem with I think the speed was slow in a different room. I've changed my position. Okay, so back to the question for the first one, whether it's required to have tested negative before you resume the duty. There is no such requirement in black and white. But if you read the CAAN directive carefully, the guidance carefully, it's written that in the case of the health measures, the directive, the decision, notices, instruction, whatever, from the health authorities shall take precedence over whatever written in this document. Since they are the health authorities in Nepal, they are the competent health authorities. So if they take any decision, that shall take precedence over our guidance. Nevertheless, nothing prevents you to take extra precaution what the government of Nepal has prescribed, right? If you protect your aviation personnel, your colleagues, so it's always, if you want to be higher than what the government of Nepal or the CAAN gives direction or instruction, the guidance, you can always make sure that your staff are well protected and take care about the well-being. So once again, I would like to repeat here about the ICAO state letter, what they had written to all the states back in March, that the states should take all the measures to control the spread of virus, number one. And number two, they urge all the member states to ensure that the air travelers and aviation professionals are well protected from the virus. In the second instance, where we have to make sure that the air travelers and on top of that, our fellow aviators are also well protected from the virus. And we have to take this fundamental thing in mind and take all the precautionary measure, how we have to take all the activities and steps to protect our aviation community. Thank you.
Thank you, Raju. And one more question I would like to direct towards Simon is, since this is the first time we are facing in Nepal, that we are facing such an aviation risk. Yeah. So even in the past of SARS, bird flu, swine flu, and even MERS, so we didn't face such a catastrophe. We didn't, so we don't have much experience with regard to this. So with that being said, so could you please share some experiences of maybe how the affected countries, how they were treating such cases, how they got around with it in their aviation perspective, so that we can get some we can learn some lessons from their experiences as well.
Yeah, I think everybody has suffered from this. Nobody expected this type of crisis, and nobody was prepared for it. And although organizations had some preparation, and I think when the early days of the pandemic started in China, there were some organizations in the UK that were starting to suddenly think, okay, we need to start thinking about not waiting for government or CAA to make any decisions. We're going to start looking at, do we start restricting and limiting our operations early? And certainly, I think it was an important thing to recognize. It's looking for those early signs and trying to make a decision early, and almost not wait until you're forced to take action, because you can still play a part in saying, actually, we're going to stop operating to a particular destination because you're suddenly seeing the risk of flying into that destination. And again, it's impacting not only in terms of spreading infection, but it affects your crews as well. I've seen, and again, certainly with some of those organizations, when they were still continuing to operate into those destinations, they were actually already starting to look at additional PPE, additional requirements, limiting the food service. All those sort of things were ways of trying to find a way of, if we have to operate into those areas, to at least put some additional mitigations in place. I think another thing to think about is also the challenges of the airport perspective as well. Because if we want to get people flying again, you know, it's not just about their willingness to fly when they get into a plane. And I know that there's some challenges around social distancing in planes. And I know in the early days of the pandemic, some operators were looking at trying to operate, but with large spaces between passengers, so having a reduced capacity. But most operators recognize that that's not sustainable as a business, and therefore the only way we can continue to operate is by putting in additional mitigations. And those mitigations are things like you know, having everybody wearing a mask on the aircraft, increasing the airflow through the air conditioning packs, and having I think, and the other thing is when they load the aircraft, they will load it by seat, you know, 5 rows at the back of the aircraft will be loaded first, then the next 5 rows, then the next 5 rows. And when the aircraft lands, nobody is allowed to get up from their seat to get their bags. So again, it's around the first 5 rows get off the aircraft first, then the next 5 rows. So trying to limit that kind of movement, limiting hand luggage. So again, trying to minimize people's movement in the aircraft, so not having to go up and get their hand luggage down, so limiting it to hand luggage that can go underneath their seats. So trying to find ways of mitigating the risk of infection without necessarily, you can't maintain social distancing in an aircraft. You can do it in the airport, but I know that that's a challenge for you in your airports, because a lot of your airports are, you know, they're crammed spaces. So you're going to have to look at how can you find ways of reducing people's time in the airports. So whether it's to do with, you know, increasing the ventilation and the airflow within the airport, is going to have to be something that you might be looking at, pushing the airports towards doing this. I know there's a lot of form filling that you need to do in terms of your your location cards. Is that something that passengers can do before they get to the airport? Is it something that they can do online, so that they're not at the airport all queuing up to write these locator cards? Is it something that they can have done ahead of arriving at the airport? So trying to think of ways of trying to reduce that risky environment where you've got people too close inside in that environment. So again, they're just things to think about in terms of how you can try and things to consider as part of that restart.
Thank you. Yeah, and such questions are also quite existent and quite relevant for the domestic air operators for Nepal, because we operate small aircrafts, and the and the concept of social distancing does not apply, because we have limited seats. So, and also some of the aircrafts will not be fitted with HEPA filters. And also there cannot be considerations for a quarantine area on such smaller aircraft, let's say Beech 1900D or Beech 1900C per se, or even on a Twin Otter. So what can we expect for these kinds of, when we are operating such, for domestic flights? So what additional barriers can we have? What are the worst case scenarios that we can expect because this is all new for us. So, so these are the primary questions, I guess, all the operators right now we have.
So it might be, especially with the domestic where you're operating the smaller aircraft, then things like having temperature checks before passengers board the aircraft, that might be something that would at least help to identify people, because there is a reduced risk because the flights are shorter time. So at least you're not, it's not a long duration flight. So you have, that is going in your favor. But again, it's around making sure that masks are wear all the time, reducing movement on board the aircraft, not providing any food or drink service. So those are the kind of things that you're going to have to try and put in place to try and manage that. And you said you can't have HEPA filters on your aircraft, is that correct?
Yes.
So again, it's around making sure that your packs are working all the time. You might have to use ground air conditioning trucks when the aircraft's on the ground, so at least you can blow air into the aircraft whilst the aircraft's on the ground and while passengers are boarding. But again, I know that's a challenge for you in terms of the size of your domestic apron as well. So it's not, nothing's easy for you. So, but again, it's just trying to find ways to mitigate the risk as best as you can.
Sure. Thank you very much. Another question we have from Mr. Sudeep. His question is, are there any recommended general checklists for personnel to follow when they return to work? Is there risk of exemptions given to the operators being arbitrary? So I guess for this, we have the guidance from Council Aviation Recovery Task Force. Simon, you had made a major hand in that. From ICAO perspective, and even from Civil Aviation Authority of Nepal, we have guidance and recommended practices to follow. So apart from that, can we have any other specifics that we can look out for? Let's say, infection on board, quarantine management for crew, so what do you do when you're flying out towards your destination, and then even in a short flight? So there's like Murphy's Law comes into play, and we have an infection or contamination per se. So what can we do on such cases?
So it might be that you're going to have to be prepared, and I assume you don't have additional crew stationed at that other destination. That could be something where you have crews, a standby crew available as a contingency, or it might be that you will have to, if you end up with a contaminated aircraft or crew, then you have to fly another aircraft out to replace that service until you've had time to be able to decontaminate that aircraft, and that crew might have to then go into isolation until it might be that they could still fly back, but without passengers on board, so that they can then come back to an area where they can isolate in a better place. And perhaps if you're stuck again, if you're at Lukla, you're going to have a challenge, because there isn't much space to leave an aircraft if it's contaminated. So again, it's around looking at this on a case-by-case basis in terms of each individual destination, about what you could do if you have an infected individual or contamination of an aircraft.
Right. Thank you very much. So finally, any final questions from our attendees? So if you have any questions, please type them down on the message board. Yes, from Yograth, sir. Okay, I'll mute you. Yes, Yoga sir.
So I don't have any question because this is just a clapping sign I have given to it from on behalf of Airlines Association of Nepal. That's what. This is a clap.
Thank you, sir. So I guess this is it. So thank you very much, Simon, for your wonderful insights and to all of this. Yeah, thank you, Carlos, for your participation. So I guess first time we're meeting. So yeah, would you like to share some words?
No, well, I would like to appreciate your effort. I have found this webinar very interesting and very useful. Simon made a really brilliant presentation touching the most important topics and issues that everybody from all angles of the aviation field have to address and have to face now. And also the insight from the Nepal Civil Aviation Authority is very interesting because they are making a great effort. This is a very difficult situation for all the stakeholders, but you can imagine that for the authorities is very, very hard times to address and to tackle and to make the best decisions in order to ensure safety and also healthy. So thank you very much, Utsav and the association, for this this webinar and this initiative. And from the South Asian Aviation Partnership Project, we are open to support this kind of events, and you can contact us if you have any questions and whatever you may need. We are here for you. So thank you very much.
Yeah, thank you, Carlos. So any final words from maybe your sir?
So thank you, Utsav. On behalf of Airlines Association of Nepal, I would like to thank Mr. Simon Robles for his wonderful presentation, and Raju sir and Mr. Carlos Menendez, so for the support and all those things. And in the meantime, I would like to thank you, Mr. Utsav, you, and President of Aeronautical Society of Nepal. So I would like to thank, a huge thank to Airlines, Aeronautical Society of Nepal for their opportunity. They have given us opportunity to be a co-organizer, Airlines Operation of Nepal. So and Civil Aviation Authority of Nepal. So all the participants, huge thank you for wonderful presentation. Wonderful participations. And on behalf of Airlines Operation, I would like to thank all of you for this successful webinar. Thank you. Thank you so much.
Thank you, sir.
Yeah, and finally, we'll also like to thank NREN, Nepal Education and Research Network, for providing us the technical support to host this webinar. And I'd like to, from the bottom of our hearts, I would like to thank Raju sir, Yoga sir, and last but not least, lots of thank you to Mr. Simon Roberts for all the wonderful insights and knowledge sharing. So with all your guidance and recommendations, yeah, we sure will learn a lot, and then we'll implement accordingly to restart our aviation in Nepal. So I hope safe flights, and I wish safe flights to all our airline operators. So see you in the sky soon. Thank you very much.
Thank you.
Thank you.
Thank you.
All right. Bye-bye.
Bye-bye.